Hello everybody, I'm Dr. Debmita Dutta and today I'm connecting with you on behalf of Morisons Baby Dreams to talk about colic. So what is colic? Excessive crying of unknown cause in an otherwise well baby is called infantile colic. Yes, I know that's confusing. So what does it mean really? So A, it means that colic is not necessarily a stomachache, even though the name implies that it is, and that colic is a diagnosis of exclusion, which means that the doctor must first examine the baby and say that everything else is fine with the baby, and only then can you call the crying due to infantile colic. So a lot of mothers reach out to me and they're like, why is my baby crying? My sister's baby, my neighbor's baby, or my friend's baby doesn't cry like this. So why does my baby cry so much? So what is important to understand is that not 100% babies will have colic, only 20% babies have colic, and that is why only those 20% will cry because of colicky pain. The other 80% may not cry due to colicky pain. Does it mean there's something wrong with you if your baby has colic? No, it does not mean that there is anything wrong with you as a mother or a parent. If your baby cries, you are not a bad mother and you should not begin to feel guilty. The excessive crying is due to physiological adjustments that the baby needs to make to live in the world outside the womb. So the baby needs to breathe with a new set of lungs, the baby needs to digest food with a new digestive system, and so on and so forth. And the discomfort caused by all this is what causes the excessive crying. How long will the crying last? So the crying increases from birth to 6 weeks and it usually resolves by 3 to 4 months of age. Now, how do you treat colic? Because the cause of colic is not known, it is very difficult to treat colic, and most of the medicines that you may buy over the counter are actually neither effective nor good for your baby. So a lot of products are available in the market to cure colic. You have vented bottles, you have gripe water, and a lot of other things that other people will recommend to you to cure colic. So none of these in studies have actually been proven to cure colic, because for the simple reason that nobody really knows what colic is. But if you suspect gas in the stomach as the cause of your baby's crying continuously, then after the feed you can place the baby on the abdomen and just pat the back of the baby for a few minutes. Never leave the baby on his or her abdomen for a long time. Just finish patting, put the baby back on his or her back, and then only leave the side of the baby. So whatever you do not stop breastfeeding. A lot of people will say, your breast milk is causing the gassiness, so stop breastfeeding. Do not stop breastfeeding. Breastfeeding has nothing to do with colic, and no matter what you give the baby, if the baby is to have colic, will continue to have colic. So since I've now said that none of the medicines or the gripe water is going to really work, what should you do when your baby starts crying and is colicky? So number one is stay calm. This is the most difficult thing to do, but it is the thing that will help you in this situation. If you panic and if you get cranky because of your cranky baby, your baby will get even more cranky, and this will then become a vicious cycle, and you will find no way out of it. What you must never do is shake up the baby in anger, so you or hit the baby. Punishment is definitely not indicated here. This is not a tantrum. This is not a discipline issue. You will have to wait for a while until your baby gets over these physiological adjustments in 3 to 4 months, and then you will have a happy baby. So good luck with that, and thank you so much.